uh, another part of wound management. So last week we learned about pressure sore management, how to prevent pressure sore, how to manage pressure sore. That all things we learned. Today we are moving on to the fungating wound management or cancer wound management. This will be taken by Sister Anna Daniel Ravu, who was our last week faculty. You all know her. Sister Anna, welcome back and over to you.
Good afternoon, everyone. Thank you very much for this opportunity. So last time we had discussed about the care of wound, but that was bed sore, very commonly found in patients, right? And especially in our bed-bound patients who are vigorously needing palliative care. Today we will see about the fungating wound. So what is fungating wound? Many of you might have seen it, and many of you may see it in future. So fungating wound is basically seen as complication of a malignant mass. And why it happens, that we will see further in next slides. So here what happens that you know that the basic nature of the cancer tumor is that it will have its own blood supply, or you can say it is capable of developing its own blood supply, and whatever it needs for the growth of itself, okay, it will develop. Okay, so from the normal cells which are there, it will transform them in the things which are necessary for its own growth. Okay, so that is why it becomes very nasty in the time, very short time period. Okay, so basically it has these malignant cells have infiltrated the epithelial cells and surrounding blood cell supply and lymph supply. Okay, so it is basically a complication of, and also it will remind the person as of the advanced disease. He will feel that his disease is now very much advanced and there is no cure possible. Okay, so why it happens? Mainly caused by infiltration of the tissues, okay, surrounding tissues and blood vessels and lymphatic vessels. It can be in the primary situation also, like where it has developed, okay? Or it can develop in the metastatic place also, okay, somewhere else. That also can happen. Okay, and why it is so important? So last time also we had seen that because our prime aim is to provide maximum comfort to the patient in whatever situation he may be, whether he will survive for short period of time or long period of time, right? Our major concern is the comfort and relief from pain. That is main thing. Okay? And it is said that about 5 to 15% of cancer patients, there are chances that it will result in fungating wound. And it becomes very traumatic because continuous, constant reminder of your own mortality, right? Or you can say disease progression. Okay? And you can imagine that when the such wounds are on the surface, especially when they are exposed to others, right? You cannot hide such lesions. So how bad it must be feeling. Okay, patient must be feeling very bad. Above and all, he may be having very much pain also. Okay, and the special characteristics of this wound are severe exudate. It can cause bleeding also, and it will give very bad stench. Okay, it will be malodorous. Okay, and mostly without treatment, they have potential to extend very in extensive region, they can become very large within no time, and it will damage massively around surrounding tissues also. So what are the characteristics, how they will look like? Okay, it will look like fungating in nature. Okay, fungal, how the fungus is, we may see many times on the food material, right? So that kind of tissues will become on the body. It will have crater like, okay, surrounding border will be there. The border may be irregular, it can be regular also, and it will have give appearance of cauliflower. Okay, that will grow very rapidly. Okay, it can ulcerate and proliferate. Even fistulas also it can create. Okay, so the organs below it or any cavity below it, okay, within no time it will get fistulated, and all the content will come out. Okay, so that happens very soon. Okay, so that is why very much emphasis is put on the assessment and the symptoms related to the lesion. Okay. So varied symptoms will be there like pain, high level of exudate, excessive bleeding, and malodor. And where it can be seen, most common sites are, it can occur anywhere over the body, but most common sites are breast wounds. Okay, and it can develop on in the case of head and neck cancer also. Okay, soft tissue sarcoma, because of kidney problems also it can happen. Okay, then some times in bladder cancer also it is seen. In case of lung cancer also it can develop over the chest. Okay, ovarian cancer, vagina, colon, penis, anywhere. It can happen anywhere over the body. And each patient will have individual presentation. Okay, it will not be like the same, or the speed of spreading it or developing it may be different from one patient to other patient. Okay, so what is the process of development? So fungating lesions, because of that, there will be rapid proliferation of cells. Okay, there, anyway, when you see the proliferation of cells in the cancer cells, if you compare with the normal cells, there won't be any specific division. Okay, so there is no time bound. Okay, it will be unlimited. Okay, so proliferation here also in fungating lesion also it will be unlimited. Appearance, as we saw, it would be of cauliflower appearance. Ulceration very fast it will occur. Okay, it will create open crater with margins. Okay, and erosion of sinuses. Okay, all the blood vessels will also get eroded. Okay, so you will have many other problems. Now, because of the vascular deficiency, what will happen? It will affect the blood flow. Okay, and the cells will be very poorly perfused. Okay, so there will be more chances of secondary infection also here. Okay, the region will become hypoxic because of less perfusion, and then necrosis will also occur very fast. And there may be absence of the normal lymphatic blood cells, or there may be abnormality. Okay, and because of that what will happen, there will be the interstitial fluid which should be coming back to the circulation, it will not come back. Okay, and because of that what will happen, more uh, vascular pressure will be created at the local site, and because of that it will add on to collapse of blood vessels. Okay, because the fluid will gather there, and because of that what will happen, small blood channels which are there, capillaries are there, that supply, tiny supply will be blocked. The collapse will take place, and because of the rupture of these vessels what will happen, exudate will come off. So you can imagine that the problems are going to increase day by day. Okay, so unless we do something, we confine the wound, Of course, that may be very difficult also, but at least we can prevent the complications. Okay, so patient problems will be exaggerated in such patients. Moreover, excessive cell proliferation, it will cause acidic pH of extracellular fluid. Okay, and that will in process interfere with the clotting mechanism. So that is why what happens, that all the blood vessels are there that will evaporate, or you can they will rupture and bleeding will take place. Okay, and the tissues will become very fragile, very friable tissues you will see, because all the time the area will remain very moist. Okay, and because of that moisture, what will happen, there will be secondary infection, bacteria will be there, then again they will also produce toxins. Okay, so more irritability at the local level, and plus there will be breakage of the fatty acids. Okay, so because of that there will be malodor. Okay, so this is all the chain of problems, how they occur, why we see specific problems in this type of wound. So how to manage this type of wounds? Okay, so here whenever we are carrying, okay, our objective will be that we give the comfort to the patient, because healing will hardly take place in this type of tissues. Okay, this type of wound. Okay, so we have to look after the patient quite well, keep the patient's hygiene very well. Okay, so that we can prevent a secondary infection. And of course the symptom control is also our primary goal. So assessment becomes very much essential from all the four factors, okay, from all the four sides of the total pain area that we will see. So this wound is chronic in nature, okay, very complex to manage, okay, and it will demand a good nursing care plan, okay, and that will depend, uh, that will be separate for all the different for all the individuals. Okay, so that is always needed, that good assessment is done for the patient. So why assessment? Because we want to identify the problems first thing, okay, how well the treatment is going on, what we need to do further, okay, how to prevent complications, okay, and whatever we are doing, whether it is producing any side effects or not, whether patient's quality of life is improving or not. Okay, so that is our main aim. Okay, so holistic approach will always help to take total account of the patient, okay, and take good care of him. Okay, so here we are going to take few minutes to list our problems of the patients. Okay, these are two patients, different patients. I have picturized them. Okay, so on one you can see that this old lady is having wound over the cheek. Okay, she had basically cancer of her oral buccal mucosa. Okay, and she developed this fungating wound. So what can be her problems? Okay, so you can jot down few points. You can share with others also in the group. Okay, put the problems in the chat box. What can be the physical problems? What can be psychological? What can be social? And what can be spiritual? Okay, in that way. Another, and this wound is very open, right? Everyone can visualize. Whereas other person is having wound over the hand or leg. Here, what we can see. Okay, so that one person can be, he or she can hide also. Right, so two different situations. So make list fast in couple of minutes. Then we will discuss further. And please share your points in the chat box. Yes, good. Altered body image, yes. Isolation, pain, yes. Feeling of shame, yes. Speech effects, yes. Infection rate can be very high. Good. Difficulty in swallowing also. Yes, yes. Yes, low self-esteem. Yes, very good. Distance from society. Yeah. Yes, malorder. Yes, sleeping problems. Financial problems. Yes, because they will need regular dressing. Dressing also too much, right? Bulky dressing. Pain may be there. Anything else is remaining? Yeah, large amount of discharge, financial, yes, pain, painful dressing, social isolation, right? Rightly said. Okay, so this type of wound will require expert care, right? In order to control many problems. Yeah, feeling like giving up, good. Okay, and so many problems. So we need to really help them. How to help them? Okay, so generally what happens is that many times patient lack the access to the expert care. Okay, and expert guidance, you can say. Okay, so instead of leading to good quality life, they tend to deteriorate, right? And many times wound becomes the primary problem rather than the disease, okay, rather than the cancer itself. Okay, so such problems will occur. So let us see a few problems I have listed. Physical problems, you can say that it will depend, of course, on the location and size of the wound, right? So on the previous slide, we had seen that one was over the face, right? And size was big, right? Other was also big, but it was, at least the person can hide it, right? So psychological, social problems also bit, little bit compromised, right? Then it will also depend on what kind of tissues are involved, what kind of the wound bed, right, it is there, then what kind of the exudate level, how much, very large amount exudate is there, or less amount is coming, what kind, right, order, how much it is, right, very profound order, it may be there that you can find out right when you are entering the house of the patient, right? So you can imagine the psychological trauma of the patient, also family, also that pain level. Okay, that will also include during dressing. Last time also we had seen. Now, because of all the surrounding tissues are also always wet, right? Because of that, what will happen? There will be lot of itching. The pH of tissues are also changing, right? So it will have, the patient will have lot of itching in the area. Okay, so there will be maceration, right? Injury, and because of that there can be secondary infection also, right? uh, how much is the effect, how the wound affects the patient's daily activities, right? Like a patient is having a wound on the face, so how about the uh, mouth care and all is going to be real difficult. Frequency of dressing change, how often, that will depend on the exudate, amount of exudate. Okay, and plus the dressing will be very much bulky, it is not going to stay in a place. Okay, that can also happen. So comfortable, it will not be at all comfortable. Okay, presence of infection. Okay, so all these are some of the physical problems. Now the psychological issues. Okay, because of the altered body image, malodor, right? So patient will feel like he's rotting away day by day. One thing is it constant reminder, right? Whenever the patient will see the wound, he will say that now I'm going to die, or he may wish that he wants to die. Right? Many times, many patients will approach you and ask that you kill me. Right? Many times relatives also will ask. So that kind of psychological trauma patients undergo. Right? Total disgusting feeling. Okay. Communication difficulties will be there. Cosmetic effects of dressing. Right? We need to see social isolation will always be there. There will be rejection from the society. They even from the family. Many family will break also because of this. The patient will be in denial stage. Many times in the initial stages, the wound can be small, so patient will say that no, this is going to get healed. He may not approach you, and then very fast it will develop into a big wound. Right. So in the beginning, patient may be in denial stage, but when he approaches you, it may be very late. Right. So that kind of situation can also occur. Patient will be having agony, feeling of rejection and defeat, that now I could not do anything. Treatment is not able to cure me. Okay. At the same time, physicians who are treating, they also feel dejected that now what to tell patient, how to disclose bad news. Everything will be associated with the wound. Patient may go into depression, feeling of embarrassment, fear, right, and guilt will always be there. What about social things? Okay, what will be the effect on the spouse? What will be the impact of the wound on the spouse? Okay, and other family members? There may be small kids in the family. They will not come near to the patient. Right, patient may be very young. So they feel really embarrassed, right? Order will be always there 24 into 7. So all the activities inside the house will get hampered. What about eating, right? In bad order, may not be able to eat with family members. No one is coming near, right? He will be placed in one corner of the house, right? Or many times such patients are placed outside of the house. They are not kept inside the house because of bad order. Right? That can also happen. The information on the needs of the patient and family is very essential whenever we do assessment. What kind of restrictions are there because of the dressing, and dressing changes, frequent dressing changes may be there. So what is happening? Patient is having too much of pain, or what? Whether patient is able to afford or not, this many dressing changes or not. Right. So caretaker also needs good amount of education. His self-respect is totally lost. Right? Sexuality, very few discuss this with the patients, relatives, and the doctors also. Feeling of shame will be there, social isolation, support, resources, everything is lost. Okay, and it all affects economical situation of the family also. Now, this is difficult area regarding spiritual issues, right? Many times patient may take it as punishment from God. Okay, why it has happened to me only? Uh, Above and all, community place them at very difficult level, right? They get isolated. They are not allowed to take part in any of the religious activities, right? So for the assessment of the this particular area, fika tool can also be used. Okay, here what you need to do is the presence, what is the amount of faith they are having, what are their beliefs, okay, how important they are giving of this particular lesion, okay, because of that, how much I mean, socially affected they are, community, what is the effects. over that and addressing specific issues. Okay, so that model is also quite good, that can be used. Okay, now let us come to the management. So basically all the four aspects we are going to manage. Okay, our care will revolve around these factors like reduction of pain, right? Then bleeding should not occur. If it occurs, then how to manage it? Because it can be a small amount also, it can be profuse bleeding also. Then what to do? Large amount of exudate is there, then how to manage these exudate? Okay, how to control the mal order, right? From the wound also and in the atmosphere also. And last but not the least, the maggots. What will happen? First, prevent that the maggots don't take place in the wound. Okay, and if at all it has taken place, what to do? And how to manage the secondary infection. Okay, so hope model also is good to do management of this kind of wounds. So let us go see one by one. So many times this kind of wound is controlled by anti-cancer treatment itself, like radiation therapy or chemotherapy. Okay, many times debridement can be done. Okay, so in that surgical management we need to do. Okay, so that can also be done. Here, the purpose of the therapy will not be of the curing, okay, but just the relief of the symptoms. Many times what happens that this therapy help in reducing the size of the wound. Okay, so further things can be controlled. Okay. Secondary is control of infection with systemic antibiotics. Okay, so that needs to be seen. So proper assessment is very much essential. If the patient is having deep pain, then what to do? So here we need to do assessment of pain. What kind of pain and how to control with the help of medicines. Okay, so uh, adjust with the adjustment doses, right, of all the kinds of medications that can be done. Whenever we need to do dressing at that time to reduce pain level, what you can do is like giving morphine. Then superficial pain is there, right, like burning and stinging type of pain. Then at that time you can always use lignocaine jelly, okay, local application, or even use opioid also locally. And always while changing, last time also we had seen that soak the dressing for 10 minutes. Okay, uh, or ask patient to take good bath. Okay, so that will remove all the adherent tissues and infected pus and everything exudate will come off, and you can clean the wound nicely with the help of normal saline. Incidental pain is there, then like a patient is having only during movement, then you can use ketamine sublingually. Okay, but all the vital signs should be monitored. Okay, now malodor. So for malodor, what to do? We have to crush the metronidazole tablets, and the powder can be sprinkled. Okay, so why did it occur? Because previously we had just saw the pathophysiology of it because of the anaerobic bacterial growth in the dead tissues. Okay, so because of that you will find the order. So daily bath is essential. Ask the patient to take good bath. Wound cleaning with saline. Okay, topical, after that topical metronidazole. Okay, that should be applied. Okay, many times we need to irrigate the wound with the help of liquid metronidazole. Okay, whatever is available in the small pints, so that can be used. Small bottles, 100 ml bottles are available of metronidazole. So with that you can irrigate. Okay, And even with the help of nebulizer also, you can place 2 ml of this solution into the machine and then you nebulize. Okay, so what will happen that the small droplets will go in the deep into the cavities. So whenever there is any uh, fistula formation like that or big cavities have occurred, okay, so that will help out. Then when the wound is painful, what you can do is make jelly of metronidazole and lignocaine and then apply it over the wound. Dressing at least twice a day is very important in any situation. And of course, it will depend on the amount of exudate also. Okay, for infection, in that case, systemic or topical antimicrobial agents can be used. Okay, even oral control can be done by using dressing containing charcoal. Of course, it is very costly in some of the parts. Okay, so that may become very difficult also, right? But with the help of charcoal, with the help of newspaper cuttings, you can absorb the vapors, malodorous vapors in the atmosphere. Okay, and atmosphere bad odor can be controlled. Even use of incense sticks are there, kapoor. Okay, these things can be used. They can be kept below patient's bed, and you can control the odor in the environment. So this becomes very essential. How to control exudate? Okay, because that will cause quite a lot uncomfortable feelings in the life of a patient. Okay, so moderate or large quantities of exudate is found in this time of wound because the local level vessels are eroded by the tumor. Okay, and because the bacterial enzymes are also produced, so that can also add into the difficulty. Okay, so if the exudate is not controlled, all the other related problems will be there. Flies will be uh, attracted. Okay, they will seed, they will produce maggots. Okay, that can be there. Then soiling of the dressing is always there. Okay, and the tissues will always be wet. The surrounding tissue will also get maceration. There will be leakage out of the dressing. Okay, and there will be lot of itching, right? So for absorption of the exudate, certain specialized material can also be used, like foam that is used, alginates can be used, hydrofibers are also used. Okay, most effective it can be like cutting of the diapers or even the sanitary napkins. Okay, cut into small pieces or the shape of the wound and place it over it. So that will help in absorbing the exudate, okay, and gives good effect. So that can be used. Infection always should be treated with the help of antibiotics. Okay, even honey and use of silver and iodine is also useful. They also have antimicrobial uh, properties, so they also help in curtailing the infection. Okay, so this is very essential. Then many times patient will have okay, there is another point also, like using of barrier film, okay, because to protect the surrounding skin, so that can also be done. Okay, protect it with the help of barrier cream or film, right, containing mainly of the silver nitrate. And of course, palliative therapy is also beneficial. We just saw in the last problem also. These are some of other agents that are used for the dressing materials. And in the table, I will be sharing this PPT with you all, so you can also read them. Okay, and what are their beneficial effects that is given. So foams, how they are benefiting, it will promote the moist wound environment and does not adhere to the tissue, prevents the uh, escaping of the material. Okay. Then calcium alginates, they are used to cover or fill the wound. Okay, that also is good absorbent. Okay, so that can be used. Honey is also very good. Bactericidal effect is there. Okay, so and it also improves the pH, right? It will lower the pH. So in that way, it will help in healing of the tissues. Then silver, gradual release of silver will provide a bactericidal effects. Charcoal, right? How it helps absorb small gas molecules and bacterial spores. So these can also help. Baking solution also helps. It is also having bactericidal effects. It also removes all the adherent dead tissues, pus and all. So helps in that way. And of course the metronidazole. What happens if bleeding take place? What to do? Okay, so mainly many times it happens during the dressing time. Okay, when you are removing the dressing, the small fragile tissue, that clot has taken place over the blood vessel, will come off, and with that bleeding will take place. Okay, so that is why soaking of the dry dressing is very essential. Okay, so at this time, if it is small in amount, minute level, then you have to press it locally and for at least 10 minutes. Okay, still it occurs, then continue for even longer time. Okay, there can be infection, so that should be treated, right? Topical application of supralfate powder. Again, the tablets are there, which you can crush and apply the powder over the wound, over the bleeding point, so it will form coating and it will stop bleeding. Systemic use of ethamsulate and tranexamic acid is also uh, used. That is also beneficial. Many times adrenaline packs are also used, but they should be used with caution because they tend to escalate or elevate the uh, blood pressure, right? So even there can be profuse bleeding from the vessel involved in the wound. So care should always be taken. And whenever it is there, we have to ask the relatives to learn how to make normal saline, right? So last time also we had seen that 2 teaspoon in 1 liter of water, or 1 pinch salt in 1 glass of water and boil it, right? And then store it in good uh, clean container. Okay, so that is how it is done. And preparation of sterile dressing. How to do about it? That cut the soft clothes, whatever are available, they should be, of course, washed nicely and dried under sunlight. Then cut into pieces, and then you can place it over the mesh like vessel, okay, over the steam in a container, closed container, okay, and keep it for 30 minutes, and then store the this dressing material in airtight container, so that will suffice the purpose. Okay, and always washing before and after dressing, that should be taken care of by the caretaker. And whenever there is bleeding, always ask the relatives to keep the dark colored cloth pieces nearby. Okay, so that they can the wound can be covered with that. Because if the light colored clothes are used, what happens that it will show the color of the blood. Right? The patient himself, even caretaker, and if the kids, whoever sees the bleeding amount, will become frightened. Okay, and it will cause lot of anxiety. So we don't want that, because it will again create raise the blood pressure and more bleeding will occur. Okay, so always tell the patient's relative to keep this type of clothes handy so that that can be covered immediately. Okay, and of course, whenever dressing is done, proper disposal of the waste material is always advisable. Right? Generally, need to burn it if the local level hospital or incinerator is available. That can also be used. And of course, the regular follow-up with the healthcare team. The either patient can be taken there or home visiting is required, then home visiting can be done. Or nowadays, lot of technology is also available. Video call can be done, and pictures can be shared. Okay, so you know where your patient is, what is the condition of your patient, because documentation always helps. Right, so that is very, very essential. And keep your patient informed. Caretaker also, then only you will get good cooperation from the patient and relatives. They will always refer to you, come back to you for their concerns. What happen if maggots take place? Okay, first and foremost thing is whenever you see such wound, always ask the patient to remain under the mosquito net. Okay, maximum time of the day he should remain in the mosquito net. And here we do get mosquito nets at the PHCs and CHCs level. So ASHA worker, with the help of them, you can always get the mosquito net. Okay. Or some NGOs may be providing, so that also can be helped out. Always tell the patient to keep the wound covered. Well covered dressing should be applied over that also. Clothing should be there. Okay. And need to change it whenever required, because the odor and the wetness will always attract the flies. Okay. And teach the patients and relatives that the maggots take place because of the flies. Okay, because they have very much wrong conception. Many times they feel that the maggots are coming from within the body. Okay, so actual principle should be taught to them. Then only they will maximum use the mosquito net. Unless they understand the reason behind it, they are not going to follow your instructions. So these instructions should be very clear. Okay, so if it occurs, what to do? Okay, we are not going to irrigate the wound with the help of turpentine. That is very, very irritating. What you need to do is soak the gauze piece or cotton swab in the turpentine oil and keep it near the wound. So what it will do, it will hamper the amount of oxygen, okay, for which is required for the life of the larva and maggots. Okay, so these maggots will try to jump out of the wound to get more oxygen. Okay, so at that time you have to take up the the maggots with the help of the forceps, thumb forceps, and then keep a ball in that also. You have to pour a little turpentine and place it in, place the maggots inside. Okay, so they will die there. Okay, and you should remember one thing, that never follow maggots into the wound. Okay, because as soon as you try to catch the maggots, they will try to go back into the wound. And if you take your forceps ends near that, then that can the tip will it is very much possible that it will cause the injury to the local tissues. So never follow the maggots into the wound with the thumb forceps. Okay, that should be kept in mind. And this again treatment should be repeated. Okay, so for in 3 to 4 days, generally the uh, wound becomes maggots free. Always keep counting. Okay, when you first time how many maggots you plucked, then second time what, so you can see gradual decrease and effectiveness of your treatment. And after cleaning the wound, you can nicely again dress the wound. And here again we are using the Vaseline dressing. Okay, so that is how it is covered. If required, you have to, in case of malodor, sprinkle the metronidazole powder also, and then nicely cover. And there should not be any gap surrounding the wound. That is must. So here you can see other materials which are used for care of maggots is mineral oil, ether, chloroform, ethyl chloride, mercury chloride is also used, resort is used, saline is of course, phenol. There are so many solutions which are used. Surgical debridement can also help in such cases, right? And along with the regular dressing, use of systemic antibiotics and drugs like ivermectin, albendazole, and clindamycin is also helpful. So psychological issues, counseling, regular visits, right? Coping mechanisms, regular talking, even on the phone, that will also help. Regular follow-up, very, very essential. Okay. Dark color clothes, okay, to hide blood, drugs to reduce anxiety, depression. So assessment is very, very essential, right? Once you do good assessment, you will come to know what is the anxiety level, whether patient is in depression or not, right? All things we can find out and treat the patient accordingly. Social needs, patient will always require good social support, okay, especially from the family members. So all the consequences should be well explained to them. Okay, and social worker can also be involved in this. Support from NGO can also help. Government support system, use of various schemes. Many times, various government schemes are available for cancer patients. So, how much they can avail them, right? We may be knowing sources also where to apply for. Many times, patients don't know where to go for to avail such schemes, right? So we should have the information regarding them, whatever is available for such patients, right? So when
Sister Anna, Sister Anna, are you there? So we lost Sister Anna, might be joined again. Today we have learned about uh, fungating wound management. So I would like to ask one question. So what are the difference between the fungating wound and the pressure sore? Last week we have learned about pressure sore. Today we have learned about fungating wound. What are the major difference between fungating wound and bed sore? Please put your answers in the chat box. Uh, Sony said infection and bad smell. Infection is more in fungating wound. Malodor is also okay. Thank you. Then Any other answers? Presence of microorganisms, it is malignant. Cauliflower appearance, okay. Metastasis wound. Those who are not right in the chat box, please unmute yourself and talk. We all nurses. Please unmute yourself and talk. Pressure sore is due to prolonged procession. Fungating wound is due to cancer progression. Okay. Can be bleed. More painful and exudate. Okay. Sister Anna, I was asking one question. What are the major difference between pressure ulcer and the fungating wound? I have received few answers. Waiting for. You can, if you want, you can share your presentation. You can unmute yourself and talk. Yeah.
That was my last slide, sister. So
Oh, okay. Okay.
yeah. Okay.
Thank you. Okay. Pressure sores are mainly found on pressure areas of the body. Okay.
Okay.
Any other answers? Okay. So the pressure sore is the major difference between pressure sore and fungating wound is the pressure sore is preventable and curable. This is not preventable and not curable. If this is incurable ulcer, once the cancer that wound develop, it's never going to heal. So this is the major difference between the pressure ulcer and the fungating wound. Okay. And any other questions? Any questions regarding this presentation? Please ask her. If you don't have any questions, I have one question. I will ask you. No questions? So I have one question. So if a person comes to you with a fungating ulcer on the cheek, you all know that you are the person to take care of that wound. Okay. So you all know that the wound is worsening, the wound size is increasing. This is not at all curable. The all things will worse. But the patient during your dressings, while you are changing the dressings, the patient is asking, sister, my wound is healing well, isn't it? How will you respond? This is the common question. While you are doing the dressings, they might be asked this question, sister, my wound is healing well, isn't it?
We have to say yes only, ma'am.
You will say yes, but
But
we learned from the communication session, don't give false hope.
just to satisfy him.
Okay. Sujita sister will try to satisfy the patient. Then says yes. Then
It may give some psychologically he may feel, oh, it's healing like that.
okay. So okay. Any other answers? We try our best to help in healing. Okay. You know this is not at all curable. But you will say try our best to help in healing. How will you help? Inside your mind, you know this is not just that maybe few minutes that maybe that patients will feel happy, but after that the patients will feel maybe after 2 weeks the symptoms will increase again, the wound size will increase, then what will he think? So 2 weeks back, sister said, "Oh yes, your wound size is comes down." Sister has agreed, but after 2 weeks, my wound size is again worsened. Tell them the truth. Explain about the condition. Okay, then any other? Do we take it as a challenge and that make his understand this is not curable, this your wound is worsening, that kind of things? Do we? Tell the truth and try to reassure. Okay. So what you can do is, thank you for your contributions. What you can do is you can listen. Whatever he say, you can listen that time. Then, if possible, you can do the individual assessment and you can explore his insight, what he understand about the illness. Sometimes he knows, yes, I have cancer, but he don't know what is cancer. So what you can do is you have to sit down and listen his worries and not tell anything. That time, if he asks some that kind of question, just listen and smile and leave the patient there. After 2 weeks or 3 weeks, he should know my own condition is worsening. That is why the sister was not telling anything. Okay, if you give a false hope to the patient, your after 2 weeks, the patients may think, oh, the nurse doesn't know anything. My wound was not healing. Anyway, the sister was telling me, okay, we will try the best for wound heal. So we that kind of things please avoid. Okay, better you can listen and try to reassure the patients and treat the patient with an empathetical mind. So that is the way to treat these kind of patients. Okay, and another important message I want to share with you all is, if possible, do the individual assessment, because in front of the caregivers they won't tell the truth. They always hide the truth. Even if the patient is having a maybe family isolation will be there, social isolation will be there. Sometimes will take care of these patients. Even then, the patient in front of the caregivers, the patients will say, "She will take care of me very well." But that is not a seen. If possible, you can do the individual assessment. Then you can get a full picture about the patient. Okay, and it was a detailed presentation. I hope the all things are clear to everyone, because there are many symptoms will be there. We all know that this is an incurable ulcer. The day by day, the symptoms will be increasing. The problem will be increasing. Physical problem will be there. Social problem will be there. Emotional problem will be there, and spiritual problem will be there. So especially the physical problem, pain. So pain, there are different types of pains will be there. Sometimes neuropathic pain will be there. Sometimes nociceptive pain will be there. Sometimes both will be there. You have to assess well. If the patient says to you like I have pain, you can just assess what is the type of pain. Then only your treatment will beneficial to the patient. Okay, and the tumor will because the tumor size will be increasing. Because of that, the tumor will compressing the blood vessels and nerves. That time the patients will feel neuropathic pain. Okay, as Anna said, always try to remove the old dressings after soaking, because the dressings are adherents to the wound. Okay, before soaking, if you try to remove the dressings from the wound, what happened is the patients feel pain. The second thing is bleeding. So these two things we should avoid if you soak well. Okay, and the next thing is bleeding. Bleeding, if there is you have to prepare the patient as well, because if they have a head and neck cancers, there is a chance of profuse bleeding. Maybe because of the bleeding only the patients can die. Because that part you have to educate the patient family. They have to prepare. If there is any accidental hemorrhage there, how will they manage? They take dark clothes. They have to prepare that dark color clothes. They have to wipe up the blood with the dark color cloth. That these kind of things you have to educate the caregivers. And the another thing is that exudate and malodor. Malodor is one of the major problem, because the other family members also will affect, because nobody is willing to that go to the patients because of the malodor. So that all that room, the whole house will be affecting because of the malodor. So what you can do is you have to apply metronidazole powder and metronidazole. These kind of wounds are fragile and a lot of pocket formation inside the wound. So your metronidazole powder will not enough that kind of wounds. That time you have to use injection metronidazole. Okay, so that will help to reduce the malodor. And another option is charcoal. Charcoal dressings are available, but the thing is too expensive. But charcoal pieces, you can take 1 or 2 pieces of charcoal and keep under the bed of the patients, or keep in the corner of the room. That will help to absorb the bad smell. So these all way we have to we can try to reduce the bad smell. Okay, and the dressing changes also frequency. Also, you can think about that. And exudate, as Anna said, you can use that. Depends on the exudate level. The exudate is oozing out of fluid from the wound. Any maybe prolonged discharge will be there. Because of that, will be affecting the patient and the family also. So the depends upon the exudate level. We can think about the frequency of changing of dressings, and also you can think about the sanitary napkins. That will help to the control the exudate. Okay, So these are things you have to keep it in mind while take care of this patient, this kind of patients, and also maggots. So they doesn't know the maggots are comes from fly. The house flies is the things to get the patient can get maggots. So this important message you should convey with the patient and the caregivers. So then only they will give special attention for covering the wound. So if they cover the wound properly, it won't happen. So this is the important message. Okay, once the house usually the house flies are attracted with the infected wounds. Once they touch the wound, they may lay eggs. Within 8 to 12 hours, come out of maggots. Okay, so that this message is also we have to convey with them. Any other questions? I think one questions in the chat. Can we use injection metronidazole for bed sore dressings if the bed sore had a bad odor? Yes, you can use injection metronidazole. Okay, we can, if you don't have any questions, we can move on to the case presentation part. In the meantime, if you have any questions, please put it in the chat box. Nurul Nadia. Okay, so to you. Sandesh.
Hello, good afternoon. Here in Malaysia, it's the afternoon. Now it's 6:37 p.m. So I am Nadia. Today I'm going to present about my patient, which is 43 years old, male. He was diagnosed with unclassified sarcoma of the right occipital scalp, matched to pleural, lung, and also subcutaneous. Next.
Wait.
So he was diagnosed. I think I need to see the patient's the history of the patient.
Yes.
So this patient has been diagnosed in 2019 when he was actually started to have a scalp mass, and then it is getting bigger over the time. He underwent few surgeries to remove the mass, but the wound will never heal. Eventually, the plastic surgeon actually did a few times of resurgerying the wound, until they tried to actually cover it with a skin flap at the right time. Until March 2021, it started to become a fungating wound. And then they did another surgery to remove the fungating mass. But months later, a new fungating wound coming back with a slightly lower place than the old one. They given radiotherapy to actually help to shrink the mass. And then he is planned for another surgery. But because of the COVID restriction that time, so the procedure has been postponed until January this year. The wound is getting bigger and bigger, and this time the doctor said the surgery cannot be offered anymore. He tried 2 lines of chemotherapy, but the disease is continuing to progress. Eventually in July this year, he started to become bedbound and was referred to hospice management in community. So on the 19th of September, he was admitted due to electrolyte imbalance and also symptomatic anemia. He received drip to correct the electrolytes and also blood transfusion. So that was the last time he was admitted. Then after that, he has been at home. and we managed the issues and the symptoms that he has in the community, and he passed away eventually in 19th of October this year. Next. So on examination, he is ECOG 4, so he is bedridden. He has multiple cancer mass all over the body, but the largest fungating wound is at the right neck that is extended to the right occipital region. The issue with the fungating wound is it is constantly has contact bleeding and also a lot of discharge coming out from the fungating wound. There is a lot of malodor, and also he is having some pain and also somatic pain that is derived from the somatic and also neuropathic pain. Next. In terms of the treatment and then the significant investigation done for the physical part for the fungating wound, what we did is actually to demonstrate again to the wife how to do the normal saline dressing, and also applying the Vaseline, the petroleum jelly, in order not for the dressing to stick to the wound and causing contact bleeding. And we also teach the secondary dressing to contain the bleeding and also the discharge that is coming out from the fungating wound. And at the same time, because of the malodor, we are using topical metronidazole. We add on some vinegar to the room, to the patient's room, and also we put charcoal underneath the patient's bed to absorb the smell. And for the pain, we are titrating his opioid and his anti-neuropathic agent according to the pain score. In terms of the social issue, he has a lot of financial burden. He has been referred to welfare department to get some financial support in terms of getting the milk supply, the diapers, and also a little bit of money for them to actually spend for their daily daily expenses. And that time wife was the main carer because they have a very young children, and then they have no one else to help in terms of the social support. So what we did for this, actually we tried to invite the immediate family members, which is the wife family, and also the patient's brother, to help to involve with his care. So not only in terms of the nursing care, but also to get help for the patient to get the medication supply, the dressing supply, so the wife will not have to go out from the house and can focus on patient's care. In terms of the emotion, patient feel very sad because he cannot contribute anything to the family anymore. So for this, we are doing active listening and so acknowledge his feeling and his frustration. And he also has self-perceived burden. So this time, we set up a small goal that is achievable for him, so that he will still have the sense of pride, and also he also will feel proud of himself about what he can do at his current situation. In terms of the spiritual, family is the main strength for him that keeps him alive day to day. So for this, we are doing frequent home visit to support not only the patient, but also the family members, the young children, and also the wife. Next. So his medication, at first we are titrating with oxynoms 10 mg PRN. Then we increase to 4 hourly. Once we stabilize the pain control, we change his opioid to long-acting medication, which is he has OxyContin 30 mg BD with Oxynom 10 mg PRN. And he also has gabapentin for the neuropathic pain that we started initially is 300 mg at night. And then we titrate until we get the good pain control at 300 mg TDS. And not to forget to start on laxative for him. So once he is deteriorating and approaching end of life, he start to have dysphagia. So this is when we convert the OxyContin to fentanyl patch, 50 mcg every 72 hours with oral morphine. 20 mg PRN. But of course, the next 2 days, actually, his dysphagia is worsening. So, and then the pain also not really good control because he still require a lot of morphine syrup that time. So we increased to transdermal fentanyl 75 mcg, and we convert the oral morphine to subcutaneous morphine 20 mg PRN, and also subcutaneous haloperidol 1 mg PRN for the terminal delirium. Next. In terms of the psychosocial aspect, because of the large fungating wound at the neck, he has body image issue, which the wound is actually scare the family members and the friends that is not used to see the big wound. And initially, wife unable to cope with the big wound dressing. But then after series of education, she is coping better, and then she can manage the dressing very well. And of course, he also has care issue, which his wife is the only carer. And at the same time, she also need to look after the children, which is still schooling. And in terms of the financial, like what I said earlier, he has a lot of issues in terms of buying dressing materials, because the wound is very wet, oozing, and then there's a lot of bleeding. So he needs frequent changing of the secondary dressing, and of course the diapers and also the other daily expenses. Next. So his main concern, he understands that his disease is very extensive and no more treatment can be offered to him. So that's why he decided to be at home just to spend the quality time with family and to manage the symptom at home without going back to hospital for any intervention and investigation. He would like us to help with the pain control, with the other symptom control at home. And he knows that wife is the best person that knows him well. So every discussion, if let's say he can't make decision, then wife will be able to actually decide on behalf of him, which is he knows that she will make a good decision. Next. In summary, I think dealing with fungating wound can be challenging, but with good attitude, knowledge, and skill, it can be managed very well. And of course, continuous support and education will be the most valuable aspect in terms of the patient's care and also the family to be able to cope better. So my discussion point for today, as a palliative care nurse or healthcare professional, what is our role in managing fungating wound, and how does it affecting the patient and family members? And any recommendation that I think maybe colleagues can actually suggest to us about controlling odor from fungating wound, because we know, though we know how to use metronidazole, how to use charcoal, vinegar, maybe you have other suggestion, and also how to manage the exudates better in your own setting. Thank you very much.
Thank you, Nell, for the wonderful presentation, detailed presentation. You did well. Anyway, sad part is the patient is no more. Anyway, the patient, we are happy to hear that the patient who has died peacefully at home. You maybe his wish was there. We can able to meet his wish because he wants to go home, and he died uh, at his home. That is the good news. Anyway, we can discuss these kind of patients will be there. The same situations will be there. We should know how to manage these kind of patients. We can discuss. As Nadia said, if you have any suggestions on this, please share your thoughts. Any suggestions, Anna?
I also feel that the patient was managed quite well. So most of the points she has covered very nicely in the presentation. So congratulations for that. Very apt presentation. Yeah.
Yes.
What else we can do for the patient from colleagues? Yes, from other
Yeah.
classmates.
The
Please
first,
share what you are doing in your setting for such patients. I want to ask one thing: how the for the control of in the previous slide, no control of the smell malodor was managed. In that it is written vinegar, use of vinegar, how it was used.
Actually, the vinegar, Miss Anna, actually I learned from Australia class, which they put the vinegar into a small pot, and then that pot you just put next to the patient's bed, so it will absorb the smell from the wound. But my difficulty is because the wound is at the neck, so I have difficulty to actually put a stable dressing to the neck region, because otherwise I cannot actually put the plaster to the hair. So the problem is whenever we put the new dressing, then it will move easily, then all the oozing, the discharge is like going to the bed, going to the mattress, going to the pillow. So that's my difficulty, because we cannot use the normal, like other wound, we can easily use plaster to plaster that to the body, but to the neck region with the huge fungating wound, I think that is my challenge. If let's say colleague can have more ideas how to do that better in the future.
Maybe by help of some bandaging, like head bandage or something like that, because of course plaster using adhesive won't be beneficial, and because of the circumference and all shape of the head, it is of course a problem even with the bandage. But with the pad, maybe bandage can be
yeah.
used. Like
So
how we use ear bandage, no? How we tie ear bandage like that.
yeah, yes, Anna said you can use the gauze roll bandage for that. If they have a head and neck cancers there, you don't can't apply the plaster micropore. So that time you can use the gauze roll bandages. Okay. And another thing is try to use normal saline for cleaning the wound. So normal saline is the best solution for cleaning the wound. If you use any other solutions, it is not going to be helpful to the patient wound, because this is not at all curable, not able to heal. So if you can apply normal saline, you can wash with normal saline and apply metronidazole. So metronidazole is the one of the good medication for controlling anaerobic bacterial infection. The drug of choice of controlling anaerobic bacterial infection is metronidazole. So that is the good medications you can apply on for that. Because and another thing is injection metronidazole. If the tablet metronidazole is not help, then you can think about injection metronidazole, then charcoal dressings, and or if the patient is not affordable, you can think about charcoal piece. Okay, and so I would like to ask one question. That what was the cause of death? Any problem? Any symptoms? Bleeding or breathlessness. So I would like to know the cause of death.
sorry, Miss. I didn't get.
Yeah, so what was the death? So he went his home and he died his home peacefully. So what was the cause of death? Bleeding or breathlessness or any other problems?
Oh, actually, he has been deteriorating for the past 2-3 months before he passed away. So he died mainly because of the disease progression from the cancer itself. He didn't experience any breathing difficulty. He also not having any massive bleeding at home. So we did prepare the family members in case bleeding what to do, but gratefully it didn't happen, and he just eventually become weaker and weaker, and he died without any pain, without any bleeding. In fact, the fungating wound also become dry and dry. I think about 1 week before he passed away, the discharge is not so much anymore.
Okay, so good news. Thank you. So how was his family right now?
Now the wife is staying with the 4 children.
Okay.
Wife is the main breadwinner. The house, actually the patient managed to change the name to wife name. So wife has accommodation to stay, and then now the wife has started work in a kindergarten. So she will be having the finance help from her own salary, and patient also has left a little bit of money for the family members to actually survive. But because a wife also start working already, so I don't think they will run into trouble. And all the children also has started schooling as usual.
Okay, so again, thank you. So always you have to think about his family too, because their loved ones is lost, but we need to think about the family, the his children's education. If possible, you have to maybe if this case they can afford, they can manage some way, but sometimes the poor patients, they are not managed. Maybe the wife is illiterate, but that time the children's educations will drop. So that time you have to think about the education rehabilitations. You can connect the local NGOs or any palliative care institution nearby there. You can connect with them, and so that they will get some donors, and maybe they will get proper education after his death. Also, the educations will continue. So that also you have to think about. Anyway, Nadia, you did well. You managed well. Thank you for hearing that wonderful story. So always, as uh, Nadia said, you have to think about the physical problem, social problems, emotional problem, and the spiritual problems. Then only the total care will be there. And also, if the end of life situation, if they want to go home, you have to send them home, and educate the family members, educate the caregivers, and strengthen the caregivers to provide care for the patients in end of life care too. And you have to encourage them, and so these kind of things we need to respect their wish. Okay, thank you. Anna, anything you want to add, or any comments?
No, that's all from me.
Okay.
Thank you very much. Yeah.
Thank you. I think we can wind up.